All right. So when we look at a lips, the first thing I look for is, do I have a defined border? Okay. Meaning where the vermilion meets the skin, that we call that the vermilion border, is that well defined? And on her, it is well defined. Yeah. Younger, more defined. Older, less defined. It gets blotchy.
Okay.
Like the wrinkles get in the way, things of that nature. Okay. So we have a well-defined border. So do we need to do border work? Probably not. Okay, because she has a well-defined border. If she did not, then what I would do is the first thing I'm going to do is I'm going to do border work, meaning I'm going to put a little bead of filler right on the inside of the vermilion. Okay, if I wanted to do border work, and you could on her, and it would turn out really, really well. You never do border work on the vermilion or over the vermilion border, because then what's going to happen is going to migrate up, and this is what gives those people those duck lips. Okay, so does she need border work? No. If we did a little border work, it'd be okay. Yeah, and then what we would do is we would just put beads of filler right underneath the border. Okay, so that's number one. Number two, the shape. Do we have a good shape? This is called the Cupid's bow. And yeah, she has a nice, cute little Cupid's bow. Sometimes if the philtrum column is not defined, you could put your needle right in here and come up and put a little bead down to make that little philtrum column pop. I don't know that we need to waste filler on that today, because she's got, it could probably maybe be reinforced a little bit, but she's got a nice little Cupid's bow right there. Okay. And then the next thing I look for is ratios. Okay. Do you remember what the appropriate ratio is for lips? What is it?
Oh, it also depends on the nationality. So
100%.
Like you have the Asian American, they like it 50-50, but fuller in the middle. When you had the Hispanic, it was 50-50. But normally, like on hers, I would probably say that hers needs to be more about like, she needs more on bottom. So I would do her like maybe, I don't know, John.
Well, the question was, what is the perfect ratio on a Caucasian woman? And the perfect ratio on the Caucasian woman is the top lip should be smaller than the bottom.
Right. So
and it should, 60. You got it, like 40-60 or 33-66, somewhere in there. The actual ratio is 1 to 1.61. It's called the golden number. It's an actual mathematical concept. We see it all over nature. It's this like perfect ratio, and that's what the ideal lip is. Okay. Now I preface that because a lot of her generation are on Instagram and they see people like the Kardashians and these people of different ethnicities and races, and they tend to have 50-50 lips. So they'll come in and asking me to do a 50-50 lip, and I caution them not to, because it doesn't fit a Caucasian woman.
Right.
And ultimately, you're the ultimate authority on this. You don't want to be doing something that's going to make her look fake, because if we did a 50-50 lip on her, everybody would know she had filler.
She had it done. Do you want people to know you have it done? I mean, it's okay if you do. Kelly's fine.
Yeah, I mean, we can give her exaggerated lips too.
Yeah, nothing like crazy, but a little noticeable.
Okay.
But not like.
Well, it'll definitely be noticeable.
Yeah.
Okay.
Yeah. But like when you smile, you have a thinner lip on top when you smile. So that's where.
Yeah, that's
also why I wanted filler in the
but that's also normal. And you could always turn off the orbicularis oris with some tox, do a lip flip, and it won't thin out when she smiles.
Have I done a flip on you yet? Okay.
Yeah, four little things. Okay, so she actually has the perfect ratio right now. So the top lip's a little smaller than the bottom. I like that her bottom lip's already kind of pouty. We're going to make that better. And then the next thing we look for is look at her. We want to make sure the distance between the lips and the bottom of the nose is about 1/3 of this distance.
Okay.
So this should be 2/3. This should be 1/3. Okay.
That's good.
And look at that.
Perfect.
Okay. So that's good. Now, as we age, this tends to all drift down. And when that happens, what I might do is I might put more on the top to shrink this, or to make this, like, you can't change where her lips come together.
Okay.
But you can sure fake the eye to make this look narrower.
Right. Right.
So if her lines went down here, I'd be focusing mostly on the upper to make it look
larger.
To make that gold. This is also that 1.16 right ratio.
So right now your lips themselves, they're like a perfect proportion.
Yeah, this is a good one to practice on, because you can't mess these up. Well, you can, but
which won't.
All right. So then look straight ahead. The other thing I'll do is I don't like to inject lateral to the corners of the nose. Okay. So I don't like to inject this area of the mouth near the oral commissure for most people. And the reason why is if we flip that out.
Oh yeah.
It makes her look duckish.
Yeah.
The lips need to disappear.
Right. Okay.
And if you focus mostly on the middle,
Mm-hmm.
oh, close your mouth. If you focus mostly on the middle and not on the edges,
Mm-hmm.
it'll look better.
Yeah. Okay.
Okay.
So I was wondering, like, because I went back last night and I watched all the fillers again,
Mhm.
and that was the one thing I kept noticing is like you weren't going to the corners.
No.
You were like coming
Very,
up.
very rarely.
Okay.
Very rarely will I do that.
Okay.
Even when I do border work, I don't do that
Okay.
because this is what will happen,
Yeah.
and it doesn't look good.
Mm-mm.
So keep
Okay.
it in the middle. You fill the middle 2/3, the lateral 1/6.
Leave it.
Leave it,
Okay.
and that tends to work well. So I think with her, the best technique we're going to do is fence posting.
Mhm.
Fence posting is. Do I have a video of fence posting?
Mhm.
Yeah. So we'll take the needle and we'll go into the vermilion. We'll go up to the wet dry border.
Right.
That's the wet dry border, and then we'll just lay a little bead as we go retrograde. Okay, and we just lay little beads all the way
Okay.
through. There's variations to that. You can like come in here and lay a bead like that
Right.
from one hole. You can do that. You can also do that on top. But I just like fence posting. Just
Okay.
fence post, maybe 3 or 4 on each side of the bottom
Okay.
lip. And then on the top lip, we'll do a fence post that goes to the middle of the top lip,
Mhm.
up.
Okay.
We'll turn our needle, go down to the wet dry, pull up. And those two techniques, pulling up, will actually make the Cupid's bow pop a little bit more.
Mhm.
And then we'll go fence post, fence post, fence post, fence post.
Okay.
Fence posting is pretty painful, so I'd like to do a dental block on her.
Okay.
So we're going to do a dental block on you if you're okay with it. Can you tolerate pain?
Yeah. I was like, I'm not scared of a little.
Okay, well, if she's not scared of pain, we could do topical. It's going to be about 16 pokes. So you'll be okay?
I think
We can always stop and do a dental
Okay.
block if we have to.
I think I should be.
All right, we'll get some numbing cream on you, and then we'll go get the product mixed up, and then we'll
Perfect.
go from there.